Welcome back. Well, as your kids hit the practice field this week, doctors want to spread a warning about concussions. So joining us to talk about this is neurologist Daryl Camp. Dr. Camp, thanks for joining us this morning. We certainly appreciate it.
Thank you.
All right, so how prevalent are you seeing concussions nowadays?
Concussions are very prevalent, and in fact, they're increasing. I don't know if they're increasing. You know, some have suggested a 200% increase in the past few years, and that's probably because I think we're doing a better job at recognition of the symptoms and signs. So whether they're truly increasing or we're just becoming better at understanding them may be the case.
Well, and it can seem obvious if somebody passes out or they take a really big hard hit, but are there, you know, concussions, can they happen without maybe something big happening?
You actually bring up a great point, because the reality is you don't have to pass out to have a concussion. Sometimes concussion symptoms are mild, and I think that's what makes it very difficult sometimes to understand. You're going to want to recognize some of the signs and symptoms, and they can be very subtle. It can be headache is one of the common ones. You know, sometimes it's just a little bit of fogginess in thinking and cognitive problems. It can be problems with concentration, sleep difficulties. So if you start to recognize any of those signs and symptoms in your child who's playing sports, I think that's very important, and it could suggest they've had a concussion or have had multiple concussions, which is even more serious.
Well, and it seems like this conversation is typically brought up during football season, but this is a year-round problem you see across sports.
Right. Yes, absolutely, and probably 70% or so, it's estimated, of concussions occur in football. If you think about a football helmet, it doesn't prevent a concussion. It may prevent a skull fracture, but it doesn't prevent a concussion. And because the impacts are so heavy in football, we do see that, but you're right. You look at soccer, whether it's females or males. If you look at other sports, lacrosse is a good one. You know, field hockey or ice hockey, even sports like wrestling, we see quite a number of you know, concussions.
And Dr. Camp said the least sport is swimming, so you're safest if you want to be a swimmer. But do you feel like coaches are more informed and they're trying to help their players more now than maybe in the past?
Certainly, and I'm a bit older, but when I was playing sports, we didn't have the trainers, and we didn't have the, usually there's a physician associated with the team now, which is very important, and they've become, you know, more acclimated in understanding the idea of concussion, as well as training in the coach's understanding. So yes, I think people are becoming more aware, and again, I think that goes back to the idea that they're increasing in frequency. It's just because we're more aware.
All right, all good information. Dr. Camp, thank you so much for joining us this morning.
Welcome.
We certainly appreciate it. All right.